And I'm really excited because my patient here has the perfect structure to really give a nice amount of feature enhancement. The one thing that I noticed with him, the beautiful blue eyes, but he's starting to get a little bit of sagging here in the midface, and he has a nice lip nose ratio, but the chin's recessed. So if we bring the chin forward, support the under eyes, and give some definition in his jawline, he's just going to look a lot better without a trace. Nobody will really notice that he had anything done. They'll just think he looks great. So I want to start with our focal point, which is going to be our cheek and our chin. And so I'm going to start in the chin area, and basically we go right down the bone. Now with him, it's very different than a lot of the other cases that we've done. He doesn't have a lot of volume here. So I want to go nice and slow, directly across, horizontally, similar to what we would do with an implant, right onto the bone. And this will make a big difference in his overall profile. It's going to feel a little strange, but I want you to show them the profile as we make changes. PJ? You hold there, just make sure he doesn't move. I'll keep holding this. Good. Okay, so we're going to keep building out that profile. Now here's the thing, Radiesse is a calcium-based filler. It gives a lot of lift and a lot of structure. I like it for this area significantly. I don't want to go too wide for him and change his overall look, because he naturally has a little bit of an angle. So if I draw a line from the corner of his eye down, we really don't want to go much further than this area right here. Otherwise it's really going to change a little bit of his proportion. And so, again, this is one syringe, which you guys can see a big improvement already in the profile. I'm going to leave it at that for right now, even though I would do another. I'm going to go work my way over to his jawline. So now, on his jawline, so you can see we've now created a little bit more proportion. Turn your head to the right. Bite down for me. I want to show everyone. Perfect. Your head up a little. There you go. So we're following right at the edge of the jaw. We're going to go directly to that gonial angle. And we're just going to sort of define out a little bit of this 90 degree. What I want to do is create a little bit of like an actual line here, because he doesn't have it as defined. And that's going to really just power this masculinity, because it's really going to give him a lot of structure here. Okay, I'm going to go to the other side. I'm going to rotate. Go ahead and massage your pizza. How does it feel? Are you doing okay?
Doing great.
Excellent.
Do we numb before? Yes, we put numbing cream all over his face.
He's also never done this before. It's a first timer. And again, I'm very honored that he's going to me, because I want a subtle, natural look. The look right now tends to be very overdone, super structured. I like to do feature enhancement, not feature change. So go ahead and turn this way. Now, obviously, immediately afterwards is a little bit of a different story. People look swollen. It does look very different. People freak out. I've had people cry. And then 2 weeks later, they're calling for more fillers. So again, you gotta give it time. You have to understand the process, have the realistic expectations. So we're really just giving, again, defining out that 90 degree angle and giving him more of a line here that's defined. And there's different ways to do it. Go down, bite. There you go. Good. I want them to show exactly right here where we're really building that structure. Okay. So go ahead and switch. What are they asking?
Do we numb before?
Mm-hmm.
Do you numb before? What kind of filler is this?
Always numb. Turn this
What kind
way.
of filler is this?
So look up now straight. So this is Radiesse, a calcium-based filler. I like this because he's going to get a little more structure. Oh, one sec. I'm doing about a syringe area right now for him. I'm really trying to get him something noticeable here because it's really going to make his facial features pop if we do. I'm going to be a little selfish and say like a little 0.2 extra for his chin because I want a little bit more there. Because it's going to balance out a little bit more. Bite down. Oh my god, it's so good. Okay, so we're going to go again to here, which is probably already pretty numb. And so we get a little extra volume here because we really need it. I think it'll balance out his shape well. If we could go that side, he's going to love this. So now we're going to continue now to the opposite side. And
Hi, I'm a doctor from Venezuela. Why are your points on the mandibula are subcutaneous?
So what? Oh, they're asking about where we're injecting. So in this area, I'm actually injecting subcutaneously. You can go onto the bone, but you have a risk of hitting the parotid gland. I tend to find this result is actually super good when you do it this way. Again, there's a little bit of numbing mixed in here. Bite down for me. Relax. So it looks bigger now and it goes down, which is why I tend to tell the guys to do a little bit more than they think they need because it always looks a little crazy today and then in the next couple of days it goes down a little bit and they're like, oh, I should have done it. But you can always add and we can always add it in a couple of days, even if we wanted.
Oh, Tyler's on. He says yes.
Oh, Tyler. Hey, Tyler. Thanks for joining. Bite down again. Now look already. Look at the substantial difference now. Turn a little this way. Look at the change in his neck. I mean, not only does this change his overall profile, but look at the tightening now along the neck. Look at the 90-degree angle here. And then look at this proportion now with that additional amount of filler into the chin.
I was here a few weeks ago. I'm already ready to come back. I have so many compliments from this procedure.
Oh my God.
Love
Thank
Kenny.
you so much. Thank you. I can't wait to see you. Okay, so let me look now at his mid-face. Wow, that's really good. So again, remember I told you, I'm trying not to bring this too wide. We can widen it, but then it makes his face a little bit more round. We may put a little bit down there. The idea here now is let's give a little structure to his cheek because I want his eyes to pop and I don't want his mid-face to feel like it's falling. I also do want him to have some structure that's going to blend the structure of what we just did. Now with a woman, we would go a bit more laterally. Here we're coming horizontally. It's a little bit different of shaping. Perfect. Okay. Love that. We're going to focus at our superior medial section of the cheek.
So he's not done yet, but you guys see, like, you could already see like a more rejuvenated, lifted right side versus his left side. You guys see that? And here's a profile look.
We're using a different
one's
filler
more
here.
round.
I want a softer look because he's got more of that baby face, and I don't want him to look like older. I want him to look younger, but also more distinguished at the same time. So now we're going to rotate. You can show them the difference in the cheek.
Right.
Show them the difference that one syringe has made. Wow, that's a big difference. You could see here, it's depression here, but look here, no depression. So if I push down, look at the difference. So again, I'll push down here, look at the fold, you see? And when I push down here, no fold. Okay, that's giving support right through here. And the way we're injecting him is very different compared to what a textbook would tell you because the way his maxillar facial shape is. It's a very different structure in his mid-face right here.
Now why
than most guys.
Why is filler not a stencil? Why is every person different?
Well, that's what I'm talking about. Every facial shape, the bone structure, their signature features like him with his eyes, all need to be addressed independently and blended properly to that person's face. This is not a cookie cutter thing. We can't draw lines and then just say that that's it for him. He's unique in his own way. And so that's what I'm saying is I'm doing the filler very specific the way his facial shape is. Now again, we're focusing on that superior medial section to really get a little lift here, this side.
And here you guys can see his jawline again. It's a little bruising, but it'll go away in a couple of days.
Good. So again, my idea here is to give this superior medial support. We're gonna wipe him. Hold on, I'm just holding a little pressure. I always like to hold pressure here. There's blood supply that goes in this direction that causes bruising. So we're gonna try and prevent that. And then the last part.
Someone said, I'm afraid of migration of products.
What?
I'm afraid of migration of products.
Well, you want to go to somebody with experience, and you also want to use a product that doesn't migrate as often. Leave him pressure there, PJ. Now I'm going to work on his under eye. Now with him, we had a long discussion of the deeper trough that he has. I don't want to overdo the amount of filler here because I really don't want him to swell. I think it's very noticeable when guys get their under eyes done and then they have this puffy bag look. So we need to do very little. As we move our way up, we're going to do a little stepwise fashion. Very small amounts to just blend what we did in the cheek. And this will make it more natural and improvement, and will build over time.
Can't wait to rock out tomorrow. Brasil presente. Saludos de España.
What?
That means
What was
Brazil is present and
Oh, I love
hello
Brazilians.
from Spain.
We love our Brazilians.
They're gonna rock out tomorrow. I wonder if it's someone for the Saitan
Oh, Radiesse.
summit tomorrow.
Can't wait. So we're just doing very small bits as we work our way up in the trough. I don't want to make it too overdone. Okay.
Café from
Doing very
Brazil.
little bits of Jawline Volbella.
No, you guys can already tell he came in with more of a rounder face. It's obviously more, it's clearly more chiseled.
And
Look
look
at
at
his
the
face.
under
It's
eye
like a more
of
rejuvenated
this
look.
side versus the other side right now. Look at the cheek area. Look at the jawline. So if you guys see, again, here we're seeing that sort of lost volume. We've just enhanced our superior medial section. Now lost volume here. Now look, no lost volume, lost volume. You see how much my finger pushes in? So now we got to give this area support. Same thing on this side. We're going to work our way up into the trough. We can do it different ways. You can use cannula and other things.
Carlos Macia says, I would love to do a treatment with you one of these days. He's in Spain.
I would absolutely love for you to come. My patient here waited 3 years, you guys. You can make it. You can definitely make it.
Saludos de Malaga. Un placer verte
What does that
trabajar.
mean?
Hello from Malaga. Pleasure watching you.
Malaga. Can I have a gauze? What's Malaga?
So
Spain? Oh, it's a part of
Radiesse.
Spain? Oh, cool. Oh my god, that's what time is it there?
Your Spanish is good, thank you.
What time is it there?
It's an 8-hour, no, 7-hour difference.
7 hours, so it's probably like 10.
Oh my god, okay, so I would be watching this too.
They're ready to go out. They're just finishing dinner.
Right before going out.
Or starting dinner.
So I'm using a soft filler, you guys. Doing Volbella, we're blending his under eye. Yes, you may get a little bruising, but I want it to be perfect, and this is why I'm doing small injections for him, because this result will actually be better than if we did a cannula. And again, I'm giving some structural support under his eye as well to give volume support.
Someone
Okay,
says,
so
do you
I'm
know
going to show
Spain?
him, what?
Do you know Spain?
Do I know Spain? No. I want to go to Spain though.
A lot of people
I've
from
been asked
Spain
to
on
lecture.
YouTube and IG.
Okay. So let me clean him off. Let's do an Emer reveal. You guys, here's the thing. So long term, what we want to do is build out his chin a little more. I probably would do a teeny bit more mid-face and soften these lines here. And then look, I like this width for him, but he'll have to make the ultimate decision when it settles whether or not we want to build it even more. So give him the Instagram.
Camera reveal.
Give him the camera. Which one do you
Hi
want?
everyone, he's about to face you right now. This is...
This one? So we're going to do an Emer reveal. I'm very red right now because I just did a peel yesterday. But I just want you guys to see my patient today. I'm going to show you here. Go ahead and grab the phone. Look at yourself. This is called the Emer reveal.
He's kind of looking like a
I want
mirror.
you to make comments. I want you to look. So what do you think? So I want to show you something. Turn to the side. Look at the chin. Look at the jaw. Look at the height here. And then look at your under eyes. What do you think?
I definitely make a huge difference.
So look straight and bite down. That's what I want you to do. Look at the squaring. You see here now? The squaring off of this. And then also the width here has been brought out a little bit. We can go a little bit more, but I wouldn't go too much. Turn this way. And see the projection here. And now look at the angle here. You see that 90 degree? So I can put my finger here right on the jawbone. It's perfect. The other thing is height. We have a little bit of height. We're building this slowly, so we can do a little more, but not yet. I'm gonna build that over time. But smile, look at yourself in general. What do you think of overall squaring on?
I love it.
It's great.
It's great.
That makes me happy. So let's switch now. Hold on.
Subtle and natural.
Yeah, I want subtle. I want more natural. Let me give you that. Give him the mirror now because it looks different on that on the camera. Mirror's back. Okay, now take a look because the thing I feel like it makes much more of a difference there.
Yeah, that's really better. Definitely.
What do you think?
I love it. It's great.
So it's good because you wouldn't look at yourself and think that you had anything done. Obviously some of the swelling will go down, but overall look at the angle here, look at the projection here, softening there, and improvement in the under eye.
Great. It's very natural.
That's what we want. So subtle and natural male facial sculpting, a great result. We'll pan the image of him now and we'll follow up with him in the next few weeks. Bye guys, do a little pan, show them
See?
side by side.
One more time, let's show you everyone. Just look straight and like this is.
Yeah, just look up there. There you go.
We're gonna pan and show. Hey, it looks awesome.
I'm very happy.
Looks great.
Alright, bye guys.
It's just, it's a nice result and it looks natural.
Oh, I mean, you
But
look.
you have more